Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Approach to glomerular disease. Now, glomerular disease can be of two types. It is a nephrotic type or nephritic type. In the glomerular disease, one important thing is complement proteins. Complement proteins can be either decreased or there can be normal. Always we should think of the underlying cause in uh, should always be seen. So, underlying cause in glomerular disease is nephropathy. Pathological findings should also be seen in glomerular disease. Then, the glomerular disease can be of two types. We have nephrotic syndrome and second nephritic syndrome. The differences between nephrotic syndrome and nephritic syndrome is important. In nephrotic syndrome, the proteinuria is found to be more than 3.5 gram per day. In nephritic syndrome, the proteinuria is less than 3 gram per day. The albumin levels in nephrotic syndrome is more than 2.2 grams, whereas albumin levels in nephritic syndrome is less than 2.2. In the nephrotic syndrome, albumin and other proteins are also seen in urine. Then in nephritic syndrome, hematuria is present, whereas in nephrotic syndrome, hematuria may or may not be present. In nephritic syndrome, RBC casts are present in the urine. In nephrotic syndrome, lipids are increased, serum cholesterol is high. Lipiduria is seen. In the lipiduria, you can see presence of fatty casts are seen with Maltese cross arrangement. Then, in the nephritic syndrome, hypertension is present, and in nephrotic syndrome, also we see hypertension. In nephrotic syndrome, immunoglobulins are show increased risk of infections are seen mainly due to pneumococcus. So, in nephrotic syndrome, capsulated organisms are common. Then, in nephrotic syndrome, antithrombin 3 or protein C is lost in urine and it is decreased. So, thrombosis is increased in nephrotic syndrome. In nephritic syndrome, all of this is negative.
thank you and thank you for watching.